Imagine, one day you walk into the doctor's office with your young child. You've noticed them having trouble keeping up with the rest of the children when they play. As you explain this, the doctor decides to run a few breathing tests, and boom, the doctor diagnoses your child with asthma. Now, asthma is a very commonly known breathing issue, and you probably know someone who has asthma. But what does having asthma really mean?
Well, asthma does not have a simple and direct definition that applies to everyone. It can affect anyone in its own way. But a general definition of asthma could be a chronic or long-term disease that inflames and narrows the airways of your lungs. And with asthma, there are symptoms. These include wheezing, coughing, chest tightness, and shortness of breath. Within all this, one main problem is present: breathing issues. These breathing issues are the common understanding of what asthma is. But asthma is much more than simply not being able to breathe. Asthma has triggers that are specialized to the individual. Because asthma is such a diverse diagnosis, scholars have offered the idea of separating out the different types. This would be for a more focused understanding on those categories. But to determine what type of asthma an individual has, their personal triggers must be understood. Common triggers include cockroaches, dust mites, indoor mold, pets, pollen and outdoor mold, cold and respiratory infections, food sensitivities, exercise, weather, and stress. Some other factors that are not quite triggers but could definitely contribute are strong odors, sprays, smoke, and tobacco smoke. After understanding what sets off your asthma, you have to determine the severity of it. Doctors use a few indicators to best understand what category you fall into. These include the frequency of your symptoms, how many times you wake in the night, how many times you are relying on a rescue inhaler, to what extent your asthma is affecting your normal daily activity, and how well you do on a breathing test. After being assessed on these questions and more, the doctor will put you into one of these 4 categories. The categories include intermittent asthma, mild persistent asthma, moderate persistent asthma, and severe persistent asthma. Although asthma is not curable, there are many treatment options available. Depending on your type of asthma, your treatment options may differ, as well as some treatment options may be better suited for children. Short-term options provide quick relief to sudden asthma symptoms. These are called short-acting bronchial dilators and last around 4 to 6 hours. These include albuterol, Pro-Air HFA, Venotolin HFA, levalbuterol, or exopenex. Now, long-term control medications are for more severe and long-lasting asthma symptoms. These include inhaled corticosteroids, which are anti-inflammatory drugs, letrine modifiers, which include montelukast, combination inhalers, which are inhaled corticosteroid and long-acting beta agonist, and felofine, which are daily meds which open your airways, or bronchial dilator. And a lesser used treatment option is biologics. A brand is Nucala, and these are injection meds which are given every 4 weeks. In order to take the medications, you need an easy way to receive them. There are 3 commonly used methods in order to receive asthma medication. These include metered dose inhaler with an option of having a spacer to add an easier input, a dry powder inhaler, which is a quick and easy way to get your medication, but it's a lot harder for younger children, and a nebulizer, which puts a fine mist into the patient with a face mask. It's easier to use for larger doses and is very good to use with young children. Although asthma is generally known, lots of people do not know much to it. One day, it is very possible your own child could be diagnosed. Having this extra knowledge of what asthma is and what it entails could prove to be very useful to you and your child in the future.